Hello, welcome back. The topic today is about painkillers on stomach or NSAID, non-steroidal anti-inflammatory drugs. Simply painkillers. How the painkillers can affect the stomach. That's the video. So we all know in the previous video about the ulcers, we know NSAIDs and H. pylori infection are the main reason for stomach ulcer. So any painkiller or any pain tablets can cause gastritis and ulcer. But is it very bad to take? No. If you need, we have to take because not generally doctors don't prescribe unnecessarily the painkillers. It's given for some reason. So okay, how these painkillers affect the stomach? So painkillers, when we take, they reduces the COX-1, COX-2 enzymes. These enzymes reduce the production of prostaglandins. These prostaglandins are responsible for the stomach lining, health of the stomach lining, especially the mucus secretion. So when the prostaglandins are reduced, the mucus secretion or the lining also reduce, and they are prone for uh, gastritis and ulcer. The same way, the bicarbonate secretion is also reduced. So these things can cause easy ulcer formation. Okay. Overall, can be easily affected. Anyone can be affected, but generally, people, older the people or young, very younger the people, they can be easily affected. Number one. Number two, people with already existing ulcers or gastritis, they can be easily affected. Or people are taking some other medications, like suppose they are taking painkillers for rheumatoid arthritis. They may be already taking steroid tablets. So it's a steroid plus this painkiller. It's like a increases the chance of ulcer or the bleeding very multiple times. The same way, suppose they are taking metformin, a diabetic medication. Metformin can cause gastritis. So with the painkiller, it can aggravate the problem. So these are the or people with H. pylori infection. When they take painkiller, the chances of getting stomach problem is more. Okay. So how the patient will know that they have the painkiller induced stomach issue? Very simply, they can get pain, especially colicky pain, and with sometimes they'll even have a pain with loose motion because of that, and they can have a heartburn, they can have a belching, they can sometimes uh, they burp a lot, uh, or they can have a excruciating pain, piercing pain from the front to the back, usually pain. This is number one. Number two, sometimes they get ulcers in the mouth, you know uh, or even irritation and ulcers in the perianal region, as if they can get into constipation, they can get painful defecation, constipation, burning sensation in the motion area. So these are the other signs and symptoms. Or sometimes they feel bitter taste, salty taste, sour taste. All these things could be because of the drug induced or the painkiller induced stomach issues. And loss of appetite, bloated feel. These all, though they can happen for some other medicine also, but these are all purely for uh, uh, painkillers. And most of the time, painkillers are taken for short period. Suppose somebody hit somewhere or fell down, they may be taking for 2 days. Then for some people, so they undergone surgery, they may have to take it for 4 5 days. Or some people have a rheumatoid arthritis kind of chronic, diseases. They may have to take it for months together. So it all depends upon the duration and dose. The signs and symptoms can vary, and most of the time these can be prevented. How to prevent? So you have to tell your doctor that you're taking, what are the medicines you're taking, what are the pre-existing diseases, so that they can give you the correct dose in a proper way. Duration also they can calculate. And most of the simply, the patient, what they can do is, all painkillers should be taken strictly after food. That is very important. Good solid food. After that, they have to take the painkiller, not after the liquid diet. And especially, don't take all these painkillers with coffee, tea, or carbonated drinks. That is the worst thing they can do. So and take adequate water, liquids has to be taken. These are the simple things. And the doctor sometimes will reduce the dose or increase the dose or change the tablet, and they may even prescribe antacids and PPIs to prevent the ulcer formation, pantoprazole or even some antacid, sucralfate. All these things can be given by the doctor, or they will change the dose. And sometimes there are now painkillers are available with gastric resistant coating. They have some specialized coating. They prevent the irritation in the stomach, or they stop the damage to the stomach. Even they can take painkiller for different painkillers are there, like ibuprofen and diclofenac. These are very common. Then aceclofenac, nowadays these are very common one. And even aspirin, which is given for mostly for the cardiac problem, but that is also a painkiller. So they have a sugar coated or even then a drug coated aspirin. These can prevent the uh, stomach problems. And preferably, if you have to take the medications, take it in the morning time, or at least we say minimum there should be painkiller and lying flat should be 3 hours gap. These are the preventing things that can be done. Absolutely all the painkillers are safe, provided the right dose, right duration, under doctor's supervision. Or beyond these things, if the ulcer has come and if started bleeding, then you need professional help. The doctors will guide you what are the investigations to be done, either endoscopy, and they'll prescribe some medications to heal the gastric damage. Thank you.